Dr. Kristie Ennis from Momentum Physical Therapy, and today I'm going to show you how to fix your tennis elbow in 5 minutes or less. Tennis elbow is pain right at the outside of the elbow where the muscles in the forearm and tendons are attaching. Tennis elbow happens when the muscles in the forearm get strained, either from overusing the wrist or a shoulder that's too tight and the muscles in the forearm have to work even harder to make your arm move and lift. So what do we do about that? There are some very simple, easy steps that you can do to get rid of this. To start with, we want to look at the muscles in the forearm. You want to take a flat-edged item. The one I use is called the edge, but you can easily use a door hinge or the flat edge of a putty knife, and take some lotion. You're going to put this right over the muscles on that forearm. You're going to take your tool and you're going to follow the line of the muscle. We're trying to get blood flow going into these muscles. So what you are looking for is for that skin to turn red. Once that happens, you can stop working on that area. And if you can see right there, I'm starting to get a little bit of redness going right in through the forearm. So now that that has happened, the blood flow is starting to go, and I can move on to the next technique. You're going to take the opposite hand, pin down that muscle, and then you're going to move through a range of motion with the wrist and arm. This helps to stretch out the muscle and release the muscle at the same time. And you're going to do this until it just feels a little bit better. That can take anywhere from 30 seconds to 2 minutes. And if you have more than one spot, exactly do the same thing. Push down, and then go ahead and move that wrist around and that arm around. That takes care of the forearm. And then you want to move on to the shoulder. And there are 2 spots in the shoulder that you want to address: the front of the shoulder and the back of the shoulder. So to do that, you're going to take a ball, whether it's a tennis ball or a lacrosse ball or even a little baseball. To start with, we'll work on the front of the shoulder, and you're going to go right against the wall with the ball. The ball is going to go right at the front, and you're going to go right against that wall. And you're going to move back and forth so that you're really getting into those front shoulder and chest muscles that get tightened up. Again, you're going to do this until you start to feel a little bit better into those muscles. You're then going to take that ball and place it right in the back of the shoulder, over around the shoulder blade. Roll around until you find some nice sore spots, and then you're going to do the same thing. Roll right over it, and then go ahead and you can raise that arm up and down and bring it across the chest and back to again release that muscle and stretch it at the same time. That hits all the major areas that tend to cause a problem right in that elbow. If you're still having issues after working on these techniques, please feel free to call the office at 504-4166.